The Newsday continues here on One News Now. I'm Charles Lejano. The Health Department has laid down some guidelines on what to do should you miss your scheduled second dose for COVID-19 vaccination. To give us more details, we have Greg Gregorio. He's reporting live from Marikina. Good afternoon, Greg. Could you tell us exactly how many vaccine recipients have missed their second dose and what was the main reason behind this?
Charles, according to the data from the National COVID-19 Vaccination Operations Center, 113,000 individuals have missed their schedules for the second dose of COVID-19 vaccine. Health Undersecretary Maria Rosario Vergara mentioned that there are two main reasons for them to miss why they missed their schedule. One is that most of them have got the infection during the surge, and the others are still waiting for their 12th week schedule for the second dose of their AstraZeneca COVID-19 vaccine. Charles?
All right, Greg, so for those who did miss their schedule for whatever reason, how do they get their second dose now? And what if it's already beyond the previously scheduled date?
Charles, if the person missed his or her schedule because he got infected, all he needs to do is call or contact his barangay or LGU once he has been tagged as recovered by his or her physician. And for those others, they just have to do the same. We have also talked to vaccine expert panel chief Dr. Nina Gloriani on how long could an individual have a delayed schedule of getting his or her COVID-19 vaccine. According to Dr. Nina Gloriani, the second dose may be received even after 1 month, but they don't recommend it, as they would want to the people know that they should get their second dose as soon as possible pursuant to their schedule. Charles?
Right, Greg, for those who are fully vaccinated, we have the Health Department mentioning that the IATF has approved a green lane for fully vaccinated Filipinos who want to travel out of the country. How does this work?
Charles, according to Health Undersecretary Maria Rosario Vergara, the IATF has approved that once an individual or a Filipino who is fully vaccinated and traveled abroad and then went back to the Philippines, he or she doesn't need to be subjected to 10 days facility-based quarantine. Instead, he or she would need 7 days facility-based quarantine, and RT-PCR test is no longer needed if he or she did not manifest any symptoms. And once no symptoms has been shown or observed, the Bureau of Quarantine may issue a certification based on his or her condition and his vaccination status. Charles?
We're talking about traveling outside the country. We're talking about increasing mobility here in the metro. What is the specific threshold that the Department of Health would be looking at before lowering mobility restrictions here in the Philippines?
Charles, Health Undersecretary Maria Rosario Vergara mentioned that experts have been recommending 30% of the vaccinated population, or rather, the experts are recommending that we should have 30% of the population vaccinated before we can lower restrictions. But this is in the context of implementing 14-day quarantine for incoming travelers in the Philippines, even though they are already fully vaccinated. But under this 30% threshold as recommended by experts, there is this condition that we have to see 50% of the senior citizens vaccinated before any of this changes in our protocol can be implemented. Charles?
So 50% senior citizens. How does this relate to the so-called stratified vaccination by age strategy that has been approved by the IATF? I understand that they're shaking up the priorities now. What age group would now take priority here?
Yes, Charles, according to the Department of Health, this stratified vaccination, which is age-based, is for the inoculation of the A4 individuals or those essential workers and economic workers. According to Health Undersecretary Vergere, since we are still depending on the supply of COVID-19 vaccines here in the country, once we start inoculation of A4 individuals, the DOH recommended to start with the people aging 50 and 60, then followed by 40 to 50, then 30 to 50. Vergere said this is still in compliance to the prioritization as provided by the World Health Organization. And under this measure, according to Vergere, the vaccines coming from the COVAX facility will be the ones to be used for the individuals under A1, A2, and A3 or healthcare workers, senior citizens, and people with comorbidity. But the supply of vaccines for the A4 individuals would only come from the vaccines procured by the government. Charles?
Thanks for explaining all of that. Let's talk about this SWA survey, which says that 89% of Filipinos are worried about catching COVID-19. What did the Department of Health have to say about this?
Charles, Undersecretary Vergere said they would like to take it positively as more people are still having a perception of risk against contracting COVID-19 infection. And according to Vergere, they would like to take this opportunity to encourage more individuals to get vaccinated once they are already part of the eligible population. Because as we all know, up to this date, the ones that are eligible for vaccination are still the healthcare workers, senior citizens, and people with comorbidities. Charles?
Thanks for that, Greg. That was Greg Gregorio reporting live from Marikina. Some U.S. states are aiming to restrict support for their trans communities, which is why tech startups are now stepping up to provide trans people with much-needed telehealth services. Let's hear more from Bloomberg Quick Tip. The COVID-19 situation in the capital region is showing improvement, coming from the surge seen back in March to April. The same can't be said, however, for provinces outside NCR. We have with us Laila Panglinan to talk about findings from the OCTA research group as of today. Good afternoon, Laila. Could you tell us about the COVID-19 situation in the NCR compared to that in other provinces?
Good afternoon, Charles. According to OCTA research, they actually shown a graph, and there is a big improvement in the number of cases in the NCR, or actually as a country, as of June 3, comparing from the number of cases during last March's surge. And just to give you a quick rundown, Quezon City is still on the lead, or in the lead, in terms of COVID-19 cases for the whole country, while Davao is on second, Cagayan de Oro is third, followed by Iloilo, and then Bacolod. Because of this, Charles, our economy is also affected by 32%, or this actually brought a 32% loss to the National Capital Region. And this is actually one of the reasons why OCTA research are urging people to get vaccinated as soon as possible so that we can jumpstart the economy and to return to our old normal. And this means that we don't have to wear our face masks and face shields anymore. But still, according to OCTA research, it is most likely that we will not achieve herd immunity this year, but we can always push for population containment, Charles.
Right, you're mentioning herd immunity versus population protection or containment. What did the OCTA research group have to say about this specific concept called population protection?
Okay, so containment or containment population protection can be achieved this year opposed to herd immunity, as their graphs show that in order for the whole country to achieve herd immunity, we will be needing 33 million doses of COVID-19 vaccines for the next 6 months. So that anong buwan na tayo ngayon? We're in June. Pero it's because, you know, the supply in vaccines is one of the few challenges to our road to herd immunity. Alam naman natin, Charles, na talagang kinukulang tayo sa mga vaccines ngayon, and that is one of the reasons why the US is already donating their vaccines. So yun yung isa sa mga reasons kasi na nakikita, kaya hindi talaga natin maipupush pa for this year yung herd immunity, but we can always push for population protection, meaning that strict minimum public health standards or yung ating mga safety protocols, hindi natin dapat pinapabayaan, or we shouldn't really be laxed with, you know, being hygienic, you know, the still washing of hands and nag-alcohol and wearing of face mask and face shields, Charles.
All right, let's talk about the different vaccination priorities, Laila. I understand pa iba-iba, no? Depende kasi marami ng vaccines na pumapasok ngayon. There are talks about changing the vaccination priorities, whether it's terms of geography or age group. What is the OCTA Researchers Group recommendation about this?
Right. Kanina, that was also discussed during the Webicon, no? And the OCTA research says that they believe that in order to contain or achieve herd immunity, the government should focus on the NCR first, but they fully support the government's push on focusing on NCR +8. The comparison here, according to OCTA research, is that, for example, that the country is a snake and the NCR is the head of the snake. If we chop it off, diba? If we chop it off and everybody in the whole NCR is vaccinated, since nandun talaga yung pinakang dami, diba? Sabi nga nila that we are the capital, no, ng COVID dito sa Pilipinas. So if we chop off the head, which is NCR, it will eliminate the chances of the spread of COVID. The snake would probably die, no? So ganun din yung nakikita nila na comparison. If people from the NCR or Metro Manila would travel to other areas in the Philippines, it is less likely that we will be spreading the virus. Charles.
Okay, Laila, you're talking about cutting off the head of the snake. So in order to do that, we need to inoculate as many people as possible. But then we're getting mixed reports about whether or not people are actually coming back for their second dose, whether it's 50% or a smaller number. What is the OCTA saying about ways to boost inoculation rates here in NCR?
Right. Actually, Professor Rajit Singh Rai, Assistant Professor of the Department of Political Science in the University of the Philippines and also a fellow in the OCTA research, says that it is really important that we get this second dose. Kailangan na makumpleto natin yung proseso ng bakuna. And the issue of the 1 million people not getting their second dose is really very bothering. And I guess one of their recommendations, OCTA research as a whole, is to always remind people, whether that is the first or the second dose, that number one, the vaccination is free. Libre yan. And the LGU maybe can provide free transportation to people who are having difficulties in going to the inoculation sites. Another recommendation is probably to provide free parking for those people who have vehicles, and for companies, For companies, listen up, employers can give the employee paid vaccine leave for a day or two to get vaccinated, and probably to take the day after, a day off after, so that they can monitor adverse side effects. And lastly, to stress the public that the vaccine price is zero. Again, this is a repeat. This is a repeat, that the vaccine price is zero, while the cost of moderate to critical illness will be in the hundreds and even millions of pesos, Charles.
Yeah, it seems like it's sort of a no-brainer, but at the same time, civic duty, parang voting yan, di ba, Laila?
Yes,
so,
that's
we'll
right,
have
that's
to see
right.
what people are going to do about it. Thanks for that report. That was Laila Pangilinan. Yeah, you know, they don't stop. BTS just dropped 2 new remix versions of their hit single Butter to celebrate their smashing debut on Billboard's Hot 100. The sweeter remix infused R&B vibes to the original track, while the cooler remix is a breezy summer track, complete with guitar mixes. Hybe Label is the company behind the Grammy-nominated Septet, said they are releasing the new versions as a way to thank BTS fans for helping the group melt records left and right. Recall that Butter debuted at #1 on the Billboard Hot 100 chart, unseating Olivia Rodrigo's Good For You, which took the top spot last week. BTS has now become one of only 7 artists to earn their first 4 Hot 100 #1s in less than a year, joining the likes of the Beatles, Jackson 5, and Mariah Carey. No doubt about it, BTS can definitely pull you in like no other. And those are the top stories at this hour. Join us again later at 2 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.